Bismillahirrahmanirrahim. My name is Dr. M Ferdous. Today, actually, I'm very glad to honor and receive the prestigious invitation by GIS board members for coming to UAE to present our presentation. And with our organization and GIS have long collaboration last 4 years. So this is our first time to join with our team this prestigious conference, move forward for many cooperation, many clinical trial ongoing with us. Thank you again. So today my topic is equipment loss, how to manage. So one of the most troublesome, one of the most painful for the doctors, especially for the young doctors, how to manage this trouble. Still, I remember when I'm the fellow in 2016 and 17 in Japan. So I feel when I have some trouble in the equipment loss, patient is okay, but the palpitation with the doctors. So when this kind of things happen, how to manage peacefully and calm, quiet, today we will discuss more and more. So it's me, my name is M Ferdous. I'm the Vice President of Asia Pacific Angiology Academic Alliance and Asian Society of Cardiology. And I'm the Secretary General of the Asian Heart Association, Coronary Intervention Working Group. And I'm the Associate Editor of US Cardiology Review Journal. And the most important designation is mine is I'm working with the Professor Wu Yongjian. He is the Director of the National Center for the Cardiovascular Disease, Beijing, China, and one of the largest TAVI operator in China. And his TAVI volume per week is 6 to 8. So this is one of the important designation. So unwanted situation with a smart solution, that is the most important. So we divide in three parts, types of unloading interventional devices, prevention and treatment of device unloading in coronary intervention therapy, and prevention. So common types of unloading, so the stent is unable to pass through the lesion and is deloaded when it is sent it forward. The stent cannot pass through the lesion and is deloaded when the stent is withdrawn. So take out the techniques. So we discuss some of the very important technique because I feel like these techniques are very common. So small balloon technique. The word is small, but 80% solution came through the small balloon technique. That is the reality in the intervention cardiology technique. Guide wire winding technology, extended catheter recovery technology, triplet technology, and snare technology. So we will discuss one by one. So small balloon technique is a very common technique, like a single level small balloon with a diameter like less than 1.5, put into the either distal or either proximal along the guide wire, loaded to the stent, to the distal end of the stent, and the balloon was expanded to the ATM, and the balloon were carefully withdrawn, and we observe very carefully when we withdraw from the system. So this is some kind of animation we create, so let's see. So this part is very common. The main trouble will start when it's pulled back. Then angulation is very important in this kind of technique. Deal done. So small balloon pullback technique. So the smaller balloon is sent along the guide wire to the distal end of the deloaded device portion, then dilated at low pressure and slowly withdrawn. Entering to the guiding catheter with the deloaded device portion and finally completely withdrawn from the body. Capture the trap, choose the size, snare, castrol. There's many technology we will discuss later. So guide wire winding technology, one of the another most important technology for the this kind of problem, how to solve. So another soft headed guide wire is fed into the stent through the guiding catheter, and the two guide wires are rotated simultaneously with the same guide wire knob to engage to the distal section to the guide wire, and gently and continuously retract to the guide wire. It's like pulling the technique like this, 1, 2, 3, 4, 5, 6. So that the stent completely enters to the finger guide tube and withdraws out from the body. So another animation video, how to solve this kind of issues. So another wire we put. Then we rotate together. Then pull back. Then another trouble. It's done. Then slowly we withdraw from the system. So double guide wire technology. The guide wire is like a slide rail technology, was slowly withdrawn from the stent before the non-compliant balloon was dilated under high pressure. When multiple stents need to be implanted in diffuse lesions, the slide guide wire can be withdrawn. In stent restenosis, the newly implanted stent should be withdrawn and released when it reaches to the target lesion. So another technology we call is extended catheter recovery technology. So before we talk about all the technique, so the most important is today last two sessions we discussed more and more as the intervention cardiologist, how to become calm, quiet when we get the trouble. So actually most of the young doctors feel very panic, honestly speaking. So how to solve the panic situation, how to do the panic attack for the doctors, not for the patient. So our boss sitting here, so he told us many solutions. Number one solution, if you want to become a good intervention cardiologist, the most important is your family must be happy. If you are happy in the family, then cath lab, what happened? You can be very calm, quiet, and try to find the solution. So that is the very good idea and good solution we learned from our boss. So I think this is very important for the family life to become happy doctors, happy father, and happy husband. Thank you. So extended catheter recovery technology. So this is another technology, like the extension catheter was delivered along the guide wire, is still in the unloaded stent to the proximal end of the unloaded stent, and the balloon with a diameter of 2 millimeter wire placed in the extension catheter. So secure the guide wire and carefully push the extension catheter so that deloaded stent enter as much as possible into the extension catheter. Adjust the balloon position to the tip of the extension catheter, expand the balloon anchor stent, and then withdraw from the deloaded stent, extension catheter, balloon catheter, guide wire from the body together. So this is another triplet technology. So the proximal end of the offload stent is deformed and it is difficult to withdraw into the guiding catheter. Select a balloon appropriate diameter and the length as well, so that the proximal part of the stent is close to the tip of finger, guide as possible, as coaxial as possible, and take back. So this is the very common technology for snare technology. So let's see how it works. Then push little more. Catch. Slowly withdraw. Then trouble. Then another angulation. So when the trouble come, so we forget to the another angulation, because no matter what we catch, it cannot come out without the angulation. So this is also very learning stage for all the doctors. And when we move out, also need very slow move. At least 5% to 10% trouble again come when we take back forcefully. So these are the snares available in the market. So commonly used catching equipment, finish trap catch apparatus, and a small cavity micro snare is available in the market. So this is from very old microbuscar by Japan. People are using long time ago. So balloon break is another one kind of trouble. So push rod is easy to cause the push rod fracture fracture usually occurs at the junction of the off-road. At this point, the guiding catheter is withdrawn from the coronary orifice, and then repeated negative pressure may be withdrawn from the body. If not, then it can be withdrawn at guiding catheter. So very important message from our side. The common preventive measure, because prevention is the most accurate treatment for the intervention cardiologist. So detaining guidewire technology entry band should not be too long, can play a role in the making shake. Pull out the paragraph by paragraph means one by one. To avoid violence, a pulling microcatheter or a small balloon support, slow step-by-step withdrawal. This is very, very important, step-by-step withdrawal. So BMW guidewire and hydrophilic coating guiding wire welding point is easy to break. Should be used with caution when the guide wire retracting. Beware of guiding catheter deep insertion injury in the coronary ostium. So we also need to think about when we are using the guiding catheter. Thank you again.